Thanks for joining us again today. I'll start as usual with the daily COVID statistics. The total number of positive cases reported yesterday was 1,297, which is 17.2% of people newly tested, and takes the total number of cases to 41,256. 419 of the new cases are in Greater Glasgow and Clyde, 337 in Lanarkshire, 191 in Lothian and 95 in Ayrshire and Arran. The remaining cases are across the 7 other mainland health board areas. I can also report that 527 people are in hospital currently, which is an increase of 40 from yesterday, and 35 people are in intensive care. That is 1 fewer than the number reported yesterday. I also regret to say that in the past 24 hours, 7 additional deaths have been registered of patients who first tested positive over the previous 28 days. And that means the total number of deaths under this measurement is now 2,557. Every person who dies from this virus, of course, was an irreplaceable individual whose loss will be a source of heartbreak. So once again, my condolences go to everybody who is grieving somebody dear to them. I'm joined this afternoon by the Chief Medical Officer and also by Shirley-Anne Somerville, the Social Security Secretary. Shirley-Anne and I will both talk shortly about the new self-isolation support payment that comes into effect this week. Before that, though, I want to briefly mention the labour market statistics for Scotland that were published this morning. And I want to do this because I know that the renewed anxiety many of us feel about the virus and its health impacts is absolutely matched by the anxiety many people feel about jobs and incomes. The statistics published today showed that the unemployment rate in Scotland was 4.5% in the June to August period of this year. That figure is the same as in the March to May period, but it is higher than it was last summer. 124,000 people in Scotland were unemployed over this summer in the June to August period. That's compared to 112,000 people over the same period last year. These figures are, of course, concerning, but it is also important that while this is no comfort to anybody who has lost their job, these figures are undoubtedly lower than they would be without the support for businesses that has been in place from both the UK and Scottish governments. The UK Government's job retention scheme in particular has been really important, and of course we still have concerns that the replacement for that scheme, which will take effect at the start of November, is not comprehensive enough. And that could lead to a significant rise in unemployment, including, of course, in jobs and sectors that, while they may be struggling through COVID, nevertheless have a good long-term future. The Scottish Government will, of course, continue to make that case to the UK Government, but just as importantly, we will also continue to provide our own support whenever we have the powers and resources to do so. In total, we've provided more than £2.3 billion of support for business, and last week we confirmed £40 million of support for those in the hospitality sector and others who are being hit right now by the current temporary restrictions that were confirmed last week. We're also in the process of establishing with business our new Young Persons Guarantee to ensure employment, education or training opportunities for all young people. And last week we launched a transition training fund, and that will make training available for up to 10,000 people over the age of 25 who have lost their jobs or who are at risk of redundancy as a result of COVID. We will do all we can to protect jobs and businesses, and everybody has a right to expect that of us. But we also must remember that the most important thing we can do for the long-term good of the economy is keep the virus from running out of control. This can't be seen as a contest between health and the economy. Keeping people safe from a potentially deadly virus is a prerequisite of a strong economy, and of course in turn a strong economy is vital for our health and well-being. These are not opposing objectives, even if it sometimes feels like they are. They are instead two sides of the same coin. Now, as indicated a moment ago, I want to briefly mention the £500 self-isolation support grant. Shirley-Anne will talk more about this. But this is our payment for workers on low incomes who are asked to self-isolate and who would otherwise lose money as a result. Gillian, as I say, will give the details, but before she does that, I want to stress again why this is so important. All of us, without exception, could be required to self-isolate at any time right now. That's if we develop symptoms of COVID, or if we find through a test that we have COVID, or if we are identified as a close contact of somebody who has the virus. And when we are asked to self-isolate, it's important to stress that we are being asked to do so completely. And that means staying at home immediately and not going anywhere else for the recommended period. We shouldn't go to the shops one last time or go out to make any other preparations, because if we do that, the risk is we could pass the virus on to somebody else. So self-isolation is really hard, and it would be hard for anyone, but obviously it can be particularly hard for anyone already on a low income who stands to lose some or all of that income because of the need to self-isolate. And that's what the self-isolation support grant is for. It's one of the ways in which we try to ensure that people have the help they need while they help all of us by self-isolating and protecting us from the virus. And it recognises, and this is a really important point, that nobody should be forced to choose between doing the right thing and being able to pay their rent or feed themselves or their families. The grant is targeted at people on low incomes, but other forms of support are available for people who might need it. In particular, if you need help with food or other vital supplies while you are self-isolating, you can get help through the Ready Scotland website. Gillian will talk about other support we're providing to people to access further assistance if that is needed. But if you can't get online, you can call the National Assistance Helpline. The number for that is 0800 111 4000. I'll repeat that later on in case anyone wants that number and didn't get the chance to note it down just then. But in addition to the support that national and local government can provide, we can all help with this need to self-isolate. Employers have a role. Employers must recognise how important self-isolation is and ensure that nobody feels pressured into going to work when they shouldn't. And if it's feasible and if your employee is well enough, you should support them to work from home. And all of us, if we're in a position to, can support our family, friends and neighbours. And that's perhaps something all of us should be encouraged to think about right now. We should be thinking about how we would manage if we're asked to self-isolate. If you don't think you have anyone you can call on, make sure you have that number of the National Assistance Helpline, and I'll give it again right now, 0800 111 4000, 0800 111 4000. But we should also all think about whether we could help anybody else if they are asked to self-isolate. So if you haven't done this already, this is a good time to talk to your friends, family or neighbours and make sure that you have a way of getting in touch with each other if you need to. One of the things we've seen throughout this pandemic is the extent to which people have reached out to help their loved ones, their neighbours and their wider communities. Self-isolation over these next few months is going to be a really important way in which we can all show that sense of solidarity and help to break the chains of transmission. So we should all, as individuals, be clear in our minds that if we are asked to self-isolate, we will do that. But we should all of us, also think about the things we might be able to do to help anybody close to us if they are asked to self-isolate. So I would encourage everybody to think about that and perhaps have that conversation over the days to come with your nearest and dearest. Now, I want to end today with hopefully straightforward, simple reminder of what we're all being asked to do right now. There's a lot of media discussion today about scientific advice given to governments by SAGE, the scientific body that advises for governments across the UK. All governments just now, and you heard me try to set this out last week, have to strike really difficult balances between vital public health restrictions to control the virus and the wider well-being of individuals and the economy. And as I said earlier on, it shouldn't be seen as a competition. It's two sides of the same coin, but we have to strive to get those balances right. And so while advisors advise, governments always have to decide. And that means we'll sometimes reach a different balance because governments have to take account of all of the different factors. But as you will see from the SAGE advice that was published last night, the actions the Scottish Government is taking just now are firmly rooted in scientific advice. We're trying to strike a careful balance, but also to make sure we are doing what is needed to protect the NHS and save lives. So that is why, firstly, we are asking everyone to work from home if possible. That advice has not changed, so please continue to do that. And to employers, please facilitate that for your workforce. Second, it's why we're asking everyone across Scotland to stay out of other people's houses right now, with limited exceptions for childcare and caring for vulnerable people. Not having interaction between different households inside the home is a vital, perhaps the most vital way of stopping the virus spreading from one household to another, which is so important in getting this virus under control. So please abide by that rule too. And thirdly, it's why we're asking hospitality businesses to close or restrict operations for the next 2 weeks, so that we can reduce the places people are gathering together and giving the virus the opportunity to spread. In Greater Glasgow and Clyde, Ayrshire and Arran, Lanarkshire, Lothian and Forth Valley, all pubs, bars and restaurants should be closed. Only cafes can stay open during the day so that people who might be suffering loneliness at this time still have somewhere to meet a friend. In all other parts of Scotland, pubs, bars and restaurants can only open indoors during the day and for food and non-alcoholic drinks. I know this is tough, but the fact is, and it's a good moment, or at least a necessary moment to recognise this, the fact is that against this virus, we sometimes have to be tough. Half measures often don't work. What you find is that they will still inflict economic pain and harm, but they won't have the required public health impact. So these are the tough but necessary restrictions that we're asking everyone to abide by as we try to make sure the virus does not run out of control. In return, the government will continue to strengthen, test and protect. We will do all we can to encourage and support people to comply with the advice, including the self-isolation advice, as I've just been talking about. And we will work with businesses to ensure that they can trade safely with as much normality as is possible during a pandemic. And we'll be bringing all of this work together in a new strategic framework to guide us through the next phase of this pandemic. And that will be debated in Parliament after the October break. And finally, let's remember, all of us, what underpins all of the advice and restrictions. The 5 basic things encapsulated in fact that we can all do to stop the virus spreading. Wear a face covering when you're out and about, but especially in any enclosed spaces. Avoid places with crowds of people. Pay attention to hygiene. Clean your hands and hard surfaces. Keep 2-metre distance from people in other households, and self-isolate and get tested if you have symptoms of COVID, a new continuous cough, a fever or a loss of or change in your sense of taste or smell. These are the things we can all do as individuals to help the national collective effort against a virus that is nobody's fault, but unfortunately everybody's challenge. Back at the start of this pandemic, we all came together to protect the NHS and save lives. As a second wave takes hold across Europe and hospital admissions and deaths start to rise again, these objectives must come back to the forefront of our minds. So let's all do what is asked of us, first and foremost for the sake of ourselves and our loved ones, but also to protect the National Health Service and save lives. Thank you all very much. I'll ask Shelley-Ann now to say a bit more about support for self-isolation before she and I and the Chief Medical Officer take questions as normal.
Thank you, First Minister. Self-isolation is essential to stop transmission of the virus, but we know that being asked to stay at home for up to 14 days is tough. It can be particularly difficult for those on low incomes who do face a choice of doing what is right and getting paid. That is why we've introduced our new £500 self-isolation support grant to help low-income workers who have been asked by Test and Protect to self-isolate and who face a loss of income by doing so. The grant opened to eligible people yesterday and is able to be backdated for those self-isolating from the 28th of September. It is being paid through the Scottish Welfare Fund, which is already administered by each local authority, and I would encourage anyone who is eligible or thinks they may be eligible to apply through their local council or to get further advice to phone the National Assistance Helpline, which the First Minister has already mentioned, on 0800 111 4000. There are 4 main criteria for application. You must have been told to self-isolate through the Test and Protect service. You must be in receipt of certain benefits, for example, universal credit. You must be employed or self-employed, and you must be unable to work from home and will lose income as a result of the self-isolation. You will need to provide information to your local authority as part of that application. For example, proof of benefits and employment. You can also receive the grant more than once if you are asked to self-isolate on more than one occasion, as long as these periods do not overlap. Each local authority will have its own application process for the grant, and for those who are not eligible for the grant specifically, there may be other assistance available for financial hardship, for example through crisis grants or housing support. I also want to announce today another important new service we are putting in place to support people who are asked to self-isolate. In addition to our existing National Assistance Helpline, which has been in place since April, the local self-isolation assistance service is a proactive service which will focus initially on people who are most likely to require assistance when self-isolating. For example, the people aged over 70, disabled people, people that were on the shielding list, people on low-income households. This service will be rolled out to further groups to reach even more people and provide support to anyone who requires it. Local authorities will actively contact people in those groups who have been asked to self-isolate to identify any needs they have and offer any support that might be required. For example, around food, medication, well-being and the self-isolation support grant, or indeed other financial supports if they are eligible. The service will deliver an initial 30-minute call to assess people's needs, followed up by 2 10-minute calls through the individual's period of self-isolation. It is vital that we stop the chain of transmission by complying with the requirement to self-isolate. The local self-isolation assistance service and our self-isolation support grant are being put in place so that we can provide help to people to comply, and in doing so they protect their family, their friends, work colleagues and their community. Thank you.
Many thanks, Shirley-Ann. We'll go straight to questions now. First today is Gordon Cree from STV.
Thank you, First Minister. You've said a couple of times today that it's important that the virus does not run out of control, but given that it's now 25 days since we went past that 5% threshold, and the last few days it's been more than 3 times that, the virus is out of control, isn't it?
But I'm the last person that's going to try and minimise the challenge we face. I've tried not to do that. I've tried to be upfront and frank with people. I don't think it's true to say it's out of control. We are still working to break chains of transmission and to slow down the transmission. But, you know, we are at a very perilous point in this journey. We all need to do what is asked of us, and we need to make sure we're abiding by all of the rules, because the difference between where we are now, which is a virus that is accelerating again but not out of control, and one that is running out of control, is often a very fine one. We've chosen deliberately to intervene early here, and taken some criticism for it, particularly around the measures we announced last week on hospitality. But I think that's the right thing to do, to try to act early and decisively rather than leaving it perhaps too late and being able to get control of it then. And we have an R number that is higher than we want it to be. We've got a doubling rate that is shorter than we want it to be. Our case numbers per 100,000, though, relative to other parts of the UK, are still lower than there. So that shows, I hope, that by intervening early, we can get a grip of this again before we go deeper into winter. But, this is all tough stuff for governments and particularly for the public. Just something to flag up. It's probably just because you mentioned the positivity rate. Every day when I announce, and these numbers have been going up, so however you calculate it won't change the fact that it is rising. We announce the percentage of people who test positive from those newly tested, so it's a smaller pool than the total number tested. What we will probably start to do next week is show that number, but also show the number of the percentage positive from the total number tested, which I think is what many other countries do, because it may be right now that ours is not absolutely comparable to some other countries, and while it is high and rising, the figure that I'm citing every day might be giving a slightly inflated sense of where that test positivity rate is. But we will not be hiding anything. If we make that transition, we will show, at least for a period, the number based on the measurement I have been using, as well as the new one, so that people can see what the comparisons are. So in summary, Gordon, I am concerned about the situation we're in right now. I've been pretty frank about that. We've decided to act early and take tough measures. As we saw from the SAGE advice published last night, it's rooted in the scientific advice, although it takes account of the totality of factors that governments have to consider. But this is down to all of us, and that's not me trying to pass the buck to the public. We have a big responsibility in government. I've tried never to shirk that. But we all have to play our part in this because of how a virus spreads. We all have to make sure we are complying and abiding with the rules to try to stop it as far as we can in its tracks. Do you want to add anything, Gregor?
Yeah, I think it's very fair to say that we wouldn't have implemented the measures that we implemented last week had we been satisfied with the degree of containment that was there just now. So when you've got an R number which is somewhere between 1.3 and 1.6 in Scotland just now, we are seeing exponential growth. But the rate of growth isn't perhaps as great as we would have expected had we not put in some of the measures 2 or 3 weeks ago. Still, in relation to that, we are nowhere near the rate of growth that we were seeing in March when the R number was up as high as 3 and sometimes above. And this is an attempt to make sure that we don't reach that really accelerated phase where the transmission of an infection just, as you have described, starts to become so much less controlled with sustained community transmission. By acting now, by acting early and by acting decisively, what we are attempting to do here is to stop that possibility from taking place.
Thanks. Lisa Summers from the BBC.
Yes, First Minister, you say yourself about the worrying increase in hospital admissions that we're seeing. We're also seeing outbreaks of coronavirus in hospitals that have led to ward closures and, very sadly, in the case of Edinburgh, to patient deaths. So why is it that last week it appears that guidance was issued to health boards to stop routinely testing those patients over 70? Because it would seem more important than ever to be doing that given asymptomatic transmission, given they are the most vulnerable group, and also they may be discharged to care homes. I wondered if it is because of an issue with capacity, and if testing capacity is stretched, if test and protect is stretched, how will that be resolved within a fortnight so that we can ease the restrictions that we're currently in?
There's no issue with testing capacity right now, and I want to be very clear about that. And as you've heard me say often before, we've got to bear in mind our sampling capacity as well as our processing capacity. The processing capacity, we have had some well-publicised challenges in recent weeks about turnaround times for tests. They have improved, although we monitor that, and there's been we've had a bit of a concern again in the last couple of days. But we don't have an issue with testing capacity right now. The decisions, particularly when you talk about patients in hospital, about who should be tested, because the test is an invasive procedure, it's not the easiest of procedures, so the decisions about who should be tested routinely and in what circumstances are clinically driven. Gregor and I and the Health Secretary, as it happened, took part in a fairly extensive, detailed discussion yesterday about the next iteration of our testing strategy, where the focus was on what groups, for clinical reasons, we would look to test routinely and regularly within the patient population in our hospital. So these are clinically driven decisions. The issue, wider issue about hospital transmitted infection, nosocomial infection, Greg and I have been discussing that already this morning. I think the Chief Nursing Officer is going to be here with me tomorrow, and we'll say more about the different steps that are in place in hospitals to make sure that we are minimising as far as possible, and to the point hopefully of eradicating the ability of the virus to spread between staff and patients, or patients and patients, and testing is part of that. And there are groups of admissions to hospital that are tested on a regular basis every few days to make sure that that is part of the surveillance process.
That particular programme that you're referring to, the over 70s testing programme, as you recall, that was introduced as a pilot and was part of quite a detailed evaluation at the point in time. That evaluation has reported, and what it showed was that actually the intent of the pilot really wasn't coming through in terms of what it did in safeguarding people at all, and identifying people with asymptomatic infection at all. The yield from that reporting was actually very, very little, and so a decision was taken through particularly some of the hospital-acquired infection governance groups to kind of to halt that programme just now, and to look to see what other means more effective infection prevention and control could be introduced into those areas. And as the First Minister said, we're in regular dialogue with our nurse directors, our medical directors within those health boards, looking at the different ways that we can do that, and the Chief Nursing Officer will say more about that in the coming days.
So sorry to interrupt, if I just wanted to get clarity on that, because that was introduced in the summer when infection rates were quite low. So it would seem to me as infection rates rise, is a good thing to have that back in place again. Is it under review? Sorry, to just get clarity on that.
We will perhaps put something down so that the detail of why there has been a change to this is set out for you fully. But we are, I said in Parliament last week, we are reviewing our testing strategy. That is not exclusively about testing in hospitals, but that is part of it. And so there is no question here that testing in hospitals continues to be an important part of our approach. What we take clinical advice on is exactly what groups should be tested, how often, and what part that plays in the overall approach. And that is something that, as part of our testing review, we are looking at and discussing, and that's the discussion that I referred to that we were took part in yesterday. But we'll put down some additional detail there around just the reasons for those decisions that have been taken up until now, and then give you the detail of the process that we're going through right now. Phil McDonald from Global.
Thanks, First Minister. Edinburgh Airport said today that summer traffic is down 91% on last year. Their chief executive has told us that talks are underway to look at airport testing as a way of replacing the 14-day quarantine rule. Can you give us an update on those discussions, and what is the current likelihood that we could see airport testing in Scotland?
These are issues that are under discussion. There's a UK-wide task force looking at airport testing, and we are part of that. No conclusions in that have been reached yet, but it is something that is under discussion. I know how difficult this is for airports, but and what I'm about to say is not intended to sound as if I don't understand and have huge sympathy for the position that airports and aviation more generally is in. But in a global pandemic, there is, I'm afraid, an unavoidable element to international travel being affected, because it can be one of the ways in which we try to minimise the spread of the virus from one part of the world to another. If we deem, and if the advice to government is that clinically and logistically and operationally we can reduce the requirement to quarantine by introducing a testing approach instead, we will certainly be open to doing that. But as we have discussed in the past, I've discussed it from this podium many times, it is not necessarily going to be just a straight swap for testing for quarantine. It may reduce the period of quarantine if it is deemed to be effective, but these are things that are continue to be under discussion. Bruce Mackenzie from ITV Border.
Thank you, First Minister. The moves to loosen restrictions around visiting for care homes seem to have been widely welcomed by families across the country. But yesterday that news came at the same time as the NHS in Dumfries and Galloway said it was very concerned about a situation at a care home in Dumfries called Charnwood Lodge, where a number of residents and staff have tested positive for coronavirus. So I wonder if you could, first of all, give us any update on the situation there. And secondly, is there any further information on moves to move testing into NHS labs? Because within recent weeks, we've heard from a number of care home managers who are concerned about the length of time it's taking to get results back for their staff. And I know that in the letter from Jean Freeman to care home managers, she suggested that those moves were underway. I just wondered if you could tell us any more about the percentage of tests which are now being processed in-house by the NHS as opposed to in the private sector.
There's a few points of detail I don't have in front of me right now, but I'll come back to you on later, and that will include any update we are able to give about the situation in the particular care home. The transfer of care home testing, and this is the routine weekly testing that is done of care home staff, the transfer of that from the UK-wide Lighthouse Laboratory Network into NHS Scotland. Testing capacity is underway, and that's been done sort of health board by health board. I will get the up-to-date figures on what percentage has been done so far, but that is a process that will continue to be underway for the next little while. And it may be that we don't transfer in entirety. It is likely that there will still be some of that is done through the UK system, but more of it will be done through NHS Scotland. And the reason for that is to try to shorten the turnaround time for tests. Well, one other thing to say on testing, I don't want to get into too much detail on this, but and again, it was something Greg and I and others were discussing yesterday, we're seeing new technology or innovations in testing come to the fore all of the time. So right now, we are validating, and we publicly announced this some weeks ago, validating point of care testing machines that we have procured that allow tests to be turned around in very short periods of time. The machines are if it's in a hospital setting or another setting, by the patient. The test gets done and processed there and then. So as well as the traditional PCR testing that goes through the traditional laboratories, there's a lot of innovation to try to speed up and make testing more accessible, and that is going to be particularly important in clinical settings like hospitals and care homes. I'll hand over to Gregor on care home visiting, but if I can just say very briefly, what the Health Secretary announced yesterday is guidance for care homes who, if they satisfy a number of requirements, and remember that is to have been COVID-free for a period of 28 days, to have the go-ahead of a local public health director, then it's guidance that governs the safe reintroduction of visiting. It is not an instruction to care homes that they must do this, and it is absolutely not a free-for-all for care homes, regardless of what the position is. That it is likely that if there are local outbreaks, local health boards will decide to have a more restrictive situation for a period, but recognising the stress and anxiety and trauma often suffered by families who can't see frail loved ones in care homes. We've tried to put in place guidance to have as much visiting as possible on as safe a basis as possible. But I would stress it is guidance, not a diktat that all care homes must have that level of visiting if there are risk factors that say they shouldn't.
So we've been engaging very closely with Dumfries and Galloway Health Board in relation to Charnwood Lodge, and where there's an incident management team has been set up to oversee what appears to be an outbreak in the care home there. I have to say that the reports back from the incident management team just now have let us know that there are a number of patients and staff who've been affected by this outbreak, but that there's been extensive testing of staff and patients within that facility as a consequence of this. But I think just to go a bit further than that, this is a facility which is engaged very proactively with all the safety mechanisms that are in play in relation to ensuring as a high degree of possibility of being COVID secure as is possible with this virus, and they participated extensively in the surveillance programme within that care home as well. So I'm confident that the incident management team and the care home itself are working well together to make sure that they're containing the spread in that care home as it stands just now. In relation to care homes visiting, it is a balance, isn't it? And whilst we have, to this point in time, tried to limit the exposure of care home residents to the possibility of that virus being introduced into that environment, that has its consequences as well, and it's not without its harms, because by limiting exposure to other people and to people outside, one of the consequences of that has been the inability of people to be able to visit their loved ones, and that has real harm for the residents as well. So the care homes guidance is a balance now to make sure that we're addressing all aspects of people's care, to make sure that they continue to be as safe from COVID-19 as possible, whilst also reintroducing that connection that people need with their loved ones and their families. And we shouldn't underestimate the potential harm that is caused as a consequence of that as well. I'm confident that the guidance as it stands just now strikes that balance, and that the safeguards that are within that guidance, both for the care home itself, but also for the local public health teams, to make sure that they are confident in the care home's ability to be able to follow that guidance, all will ensure that as much of that risk has been managed as possible.
Thanks. Neil Pooran from PA.
Thanks, First Minister. In terms of the tiered alert system, which you spoke about yesterday, as did the Prime Minister, Chris Whitty seemed sceptical that the highest level of alert, the very high level, would be enough to bring the R number down below 1 in some cases. So for Scotland's system, would you consider a level that is even higher than that, which has even tighter restrictions?
So we're considering all of this just now. Obviously, the restrictions that are already in place in Scotland, particularly in the Central Belt for this next 2-week period, are already tighter than the minimum of the Tier 3 that was announced for England yesterday. I can't remember, Neil, if you took part in the update yesterday, but I made reference to the fact that at the COBRA meeting, professional advisors had made clear to governments that the minimum of the Tier 3 in the England tiered system would, in all likelihood, be insufficient to do what is required to bring the R number down. So that is something we are very mindful of, as we want to, if possible, have an aligned sort of strategic framework between the 4 nations, because I think that makes sense and gives people a bit of ease of understanding. But we have to make sure the content of that is right for the circumstances we're facing here. So it's, you know, without announcing any decisions, because we haven't reached them yet, there would be a couple of options. If we thought that the Tier 3 announced in England yesterday wasn't sufficient, you could toughen up what the minimum of that Tier 3 was, or you could have another tier above that. And these are the options we will consider over the next few days before bringing a proposal to Parliament after the October break. One of the important things, it's one of the really difficult things just now, is that, and you know, it's something Scotland has really faced up to in the last few days since we announced the hospitality restrictions. You've got a choice with this virus, and you can kind of go soft and try to, you know, hedge your bets a little bit. And the danger is you end up inflicting the economic harm but not having the public health impact, or you can be a bit tougher and everybody feels it much more, you know, and we see that with the restrictions in hospitality in Scotland, which are tougher than they are in even the Tier 3 part of England. And there is economic pain there, which we are trying to mitigate, but our hope is that it has a much bigger public health impact, so that we can hopefully, and there's nothing guaranteed here, I concede that, hopefully avoid tougher restrictions later. I think certainly speaking personally, one of the lessons, we often talk about lessons learned from earlier on, is that with the way in which this virus replicates and spreads and the speed at which it can do so, one of the mistakes you can make is just waiting too long to act and then not acting firmly enough. Now, you know, that's what we're trying to avoid and get that balance as right as possible in Scotland. And we will try and reflect that learning in the tiered strategy that we put forward in a few days' time. Do you want to add anything to that?
I think the only thing I would add is that I heard Chris's remarks that you're referring to there just now, and I think what Chris said was that the base case proposition for that Tier 3 he felt was insufficient to get below 1, but recognised that within that there was also the need for further consultation and the option for further consultation with the English local authorities to find additional measures which could be put in place in order that you would achieve that.
Scott McNabb from the Scotsman.
Thank you, First Minister. Hospital cases have topped 500 today and seem to be rising quite quickly. If this rate continues, are you concerned about the NHS capacity to cope, especially with winter coming, and especially given the decision to decommission the Louisa Jordan? Could that decision be revised?
There is no decision to decommission the Louisa Jordan. Just in point of fact, the Louisa Jordan lease has been extended. It could be extended again. What we have negotiated for when we need it is a contract to decommission it, but that is not a decision to decommission. It's just something that we will have when we eventually do need to decommission it, but there is no plan right now to decommission the Louisa Jordan. The Louisa Jordan will be there and available right through the winter, and if we deem we need it longer, we'll take steps to secure it for longer. So I just want to be very clear on that point. On your more general point, Scott, yeah, look, whenever I'm asked a question, are you concerned about this or that, my usual answer is yes. We're in a global pandemic. All of these things concern me, but you're right to point, as we have pointed to over the last couple of weeks, the rising hospital admission situation that we're seeing again just now. We've got more than 500 people now in hospital. For those who watch regularly, you might recall, I guess about a month ago, although I can't be specific off the top of my head about the date, we changed the definition of a COVID hospital patient because we had, frankly, over the summer been overcounting in hospital cases. So we've now got a definition of what is a COVID hospital patient that is much more accurate. But the reason I'm referring to that is because when we announced that change in definition, I think on the day I did it, I confirmed that that meant under the new definition there were, from memory, I think it was 47, but it was certainly 40-something patients in hospital with COVID. Today, the number I've given is over 500. So in that period of a month, we can see the increase in hospital admissions. Of course, that is a concern. Our hospital bed capacity right now, as would normally be the case in hospitals, is over 80% of our hospital capacity is being used. So clearly, that means all of the contingencies that hospitals and health boards have to make sure that they can treat non-COVID patients but retain capacity to deal with COVID patients, these are all under very active consideration. There are no plans yet. Some of the Nightingale hospitals in England were put on alert yesterday. We have not done that with Louisa Jordan yet, but we will be monitoring very carefully the position with hospital admissions to make sure that all of the things we need to do to enable our hospitals to cope, and should we need extra resource, have that available. All of that is under active consideration and monitoring, and we will continue to report on it on a regular basis. The
only thing I would add is I fully expect that hospital admissions will continue to rise over the next few weeks that we see, and the reasons for that are well understood. Partly because we're seeing a move of greater number of cases into older age groups who we know are more likely to require hospital admission. And the second thing is that we know that the lag time in terms of the disease process sometimes leads to hospital admission in the second and the third week. So people who have been infected even before those measures came into place last week may still progress to requiring hospital care over the coming days and weeks ahead. So I fully expect that those will continue to increase. But I also want to reassure you that the planning for this has been there for many, many months, and there's been contingency planning with the NHS across Scotland to make sure that there's adequate bed capacity both within the general hospital beds but also within the intensive care units to make sure that we can accommodate that rise in cases that has been anticipated.
I very deliberately earlier on today, just a final point, Scott, reminded people of the start of the pandemic when we asked people to do all of the difficult things to protect the NHS and save lives. And I think understandably, as virus levels reduced over the summer and the pressure on the NHS was clearly not as great as it was in the spring, it's easy to forget that. And when the virus has started to increase again, people have said, well, it's only young people that are getting infected, so we didn't immediately see the uptick in hospital cases. So again, we've perhaps not really been focusing on the fact that there's a purpose to all of the things we're being asked to do right now. It's about stopping ourselves getting the virus, first of all. It's by minimising the chances of us passing it on to somebody else. But it is also about making sure that we are acting in a way to minimise the virus so that we're not putting that pressure on our NHS and we're not risking unnecessary deaths from this. So it all comes back to these tough things that we're being asked to do. Protecting the NHS is one of the objectives of that, and I think it's probably the time for us all to remind ourselves of that. Tom Martin from the Daily Express.
Hi, thank you, First Minister. It's just over 6 months since Dr Calderwood left as CMO. I no disrespect to Dr Smith as interim, but can you provide an update on naming someone as on a more permanent basis as replacement?
The recruitment, as far as I'm aware, is underway, and I'm not going to hand this over to Gregor just now. So that is underway, and it will take its course. Let me just say right now, I think Gregor Smith as acting CMO is doing a fantastic job. He is a source of incredibly important and valuable advice to me, as he is to the country. But given that the process is underway, I will probably leave it there at the moment.
But just briefly, when do you hope to have somebody?
I can't recall off the top of my head. It's not a process that I am personally engaged in. it's done by, through a senior civil service appointment process. I will check. I think the recruitment advert is probably online at the moment, so if you could find it, you'd probably find that out, but we'll give you the timescales of it later on. Off the top of my head, I can't recall. Suffice to say, I am very assured at having Dr Smith standing next to me as CMO right now. Tom Peterkin from the P&J.
Good afternoon, First Minister. Looking at the SAGE documents that have recently been released, which are dated the 21st of September and call for various measures, including a circuit lockdown within sort of immediately. In hindsight, was there any suggestion that you could have done more earlier?
There will always be a question in my mind at every single stage. Are we doing enough? Should we do more? Should we have done it earlier? And I think it is really important that I never stop having that critical assessment of what we're doing and making sure that our advisors are pushing and advising us and challenging us all the time. We have to take a balanced approach. I tried to set this out last week ahead of the restrictions we announced on Wednesday. That at the early stage of this, in March, when we went into lockdown, it wasn't an easy decision for any government, but it was almost a one-dimensional decision. We had to stop this virus, and therefore we put the country into lockdown. Today, 7 months on, with the economy having suffered a lot of damage because of lockdown, people's mental health and well-being having suffered a lot because of lockdown, it's no longer a one-dimensional decision. We have to take account of all of the different harms that are being suffered right now and try to come to a balance that does what is needed against the virus but minimises all of the different harms that are being done. And it's a much more complex decision than the ones we were taking, although they were not easy decisions back in March. It is more complex now. If you look at the SAGE advice on the 21st and cast your mind back to the following day when I announced in Parliament the 10 o'clock curfew, which was announced across the UK, but I also announced that day one of the other recommendations that SAGE had made, which was the nationwide, across Scotland, ban, if I don't like that word, but for shorthand I will use it, on people from different households mixing in each other's houses. So that's the core bit of advice we're giving people just now. Don't go into somebody else's house. So we did that on the 21st. I think the 22nd, I think then or the next day, I stood here and said very openly that there was a strong strand of scientific opinion that said all 4 nations should be going further. I think I remember writing to the Prime Minister that day suggesting that we had 4 nations discussions about support for greater restrictions that would impact on the economy. And then, of course, last week we introduced here one of the other components of that SAGE advice, which was the closure in parts of Scotland and significant restriction in other parts of Scotland on hospitality. So we have rooted everything we have done in the clinical scientific advice. There will be times where we decide not to do particular things because we judge the harm of them is too great. I feel very, very strongly that as far as we possibly can, we should keep schools open because, while people will make an argument about shutting down schools and reducing all of the movement that is occasioned by schools being open, I think the harm to children's education is too great. So we should try to avoid that. So these are the balanced discussions and decisions we try to reach. But here we have absolutely tried to make sure that we are taking action that is rooted in the clinical advice, but also that we think will have a significant impact on transmission. And we hope, we have to wait and see what the figures show in the weeks to come, and we have to always ask ourselves if we're doing enough, but we hope the steps we have taken so far will have that impact. Christine Lavelle from The Sun.
Thank you, First Minister. Some care home operators have suggested that testing visitors to care homes could be a way of helping keep residents safe. Are there any plans to roll out testing to more asymptomatic groups like this, potentially using this new quick turnaround technology that you mentioned earlier?
So you might or might not have heard me talk about a discussion we were having yesterday about testing. Now, obviously, there's lots more work behind this than just one discussion, but we had a lengthy session yesterday with clinical advisors about testing, and yes, we haven't reached final decisions on this yet, but visitors to care homes are certainly one group where there is a view that rolling out testing would be potentially worth doing. Obviously, that then raises the logistical issues about how exactly that would be done, you know, how often visitors to care homes would have to be tested, and these are the practical things that will now be considered before we reach a decision on that. But our focus on our initial focus, top priority focus in extending testing is protection of vulnerable groups. Those groups, and care homes are definitely one of them, where if the virus gets into them, it does really bad damage. So people going in and out of care homes is clearly one such group that we would look to consider for testing in the future. But we will update on our conclusions around the testing strategy again, and that's a time frame I've spoken about after the October break, when we ask Parliament to endorse the strategy for the next part of dealing with the pandemic overall. Mark McLaughlin from The Times.
Good afternoon, First Minister. Last month, Jane Freeman said that we were going to be testing, or have the capacity to test 50,000 people by the end of August. It plateaued at 16,000 throughout the whole of September. We also heard from the head of Balhousie Care Group this morning saying that care home residents are still waiting 7 days for the tests. So in terms of the testing, getting up to 50,000 by the end of August, what went wrong, and why can't we get up to that capacity?
I know this is complicated, and I probably try and fail to explain all the different components repeatedly, and the fact that I'm still getting asked shows I'm not doing it as well as I should be. You're mixing up different things there. You're mixing up the capacity we have to test with the demand for testing, the uptake of testing, the sampling capacity with the processing capacity. We have, and there have been fluctuations in the capacity, the processing capacity available through the UK Lighthouse Lab network, which has been one of the things that has affected our processing capacity. But we are around overall between 30 and 40,000 tests a day. We are in the process of vastly increasing NHS Scotland capacity with the establishment of regional hubs, and there are other things that are out with all of that. The point of care testing that I spoke about earlier on, looking at different technological ways of expanding testing, like pooling testing, and getting testing closer, the processing of testing, not the sampling, closer to the people being tested. We don't have the 18,000 or thereabout that you speak about. That's the people being tested, and that is not exclusively but largely demand driven. That is driven by people who have symptoms coming forward, and that is rising, and as we go into the winter, the possibility is that will continue to rise. We have issues with turnaround times in the UK Lighthouse labs, but we don't have a shortage of testing capacity at the moment. The reason we can talk now about doing, as I've just been talking to Christine, potentially testing visitors to care homes and other groups in hospitals is because we have that increase in NHS Scotland capacity over the next number of weeks. We will set out as I say, after the October break, when we set out the outcome of our review of the testing strategy, we will set out exactly what the capacity is, how it's growing, where all of the different bits of capacity are, as well as the extension of the groups that are going to be given access to testing once we've come to a conclusion about these different issues. David Ball from The Herald.
Thank you, First Minister. Hospitality businesses who say they're being punished for a minority not complying with the restrictions have called for better enforcement of the rules rather than a blanket closure. Can I ask just for a bit of clarity whether the 16-day restrictions have been partly led by a failure of people to comply with the rules, or are these rules now not seen as sort of adequate to stop the spread of the virus? Or is it simply down to the rise in the case numbers that's led to the decision?
I mean, there will be instances, of course, where the virus spreads in settings like hospitality because there hasn't been a rigorous compliance with the rules, but that will be true in all sorts of settings. what Gregor and Jason and Fiona McQueen set this out in the evidence paper last week, is when you have a rising prevalence of the virus, you have to try to reduce the volume of places that people are coming together, where, with the best will in the world, there is a higher risk of the virus spreading. And one of the kind of settings that is included in that are settings in hospitality, where not always, but often it's places that might not have the best ventilation, where people from different households are mixing. Remember, hospitality has had a 2-metre exemption, so they've been able to operate at 1 metre physical distancing, and where alcohol sometimes makes people less, I suppose, less conscious of all of the things they should and shouldn't be doing. So it's about reducing overall the volume of that. Yes, we have to, as we try to get hospitality trading safely again, we've got to look at regulation and enforcement to make sure that the rules are being complied with. But this is about, for a period of time, just as we've tried to do in people's own homes, reducing those options for people to come together and mix together, because that's what the virus likes. It likes these kinds of settings because that's where it can jump from household to household. And I know it's really tough for hospitality, but it's not, you know, and what I'm about to say here won't make hospitality feel any better, I know that. But Scotland's not somehow doing something really kind of odd and unusual here. You look around Europe right now, and there is almost every day another country or another part of a country imposes quite severe hospitality restrictions. So, you know, the Republic of Ireland have got restrictions pretty similar to the ones in the central belt of Scotland. You've got several major cities in France now, including Paris, with pubs and bars closed. You have parts of Spain, I think Madrid has got restrictions like this in place. Brussels and Belgium, on the same day we announced these restrictions last week, said that all pubs and bars were closing for a period of a month. And, you know, Germany, I think last week in Berlin, introduced a curfew on the nighttime economy. So we are not alone in this, and it's because, unfortunately, hospitality is one of the it's not hospitality's fault. It's not because they're all breaching the rules. It's just because the nature of these environments mean that it is more likely for the virus to spread, and that's why, unfortunately, we have to reduce that, and we have to do it significantly. You know, if we just say, well, we'll shut pubs, but if a pub can serve food, they can stay open. And that takes us to actually having most places open anyway, just on a different basis. We defeat the purpose of what we're trying to do. It's better to do it properly and quite toughly for a shorter period than perhaps have to do it in a more limited way for a longer period. That's what we are hoping right now. We're not doing this randomly. We're doing it because we think it will make a difference. Do you want to add from your evidence paper?
Yeah, I mean, the first thing I would want to say is I've got enormous sympathy for people within the hospitality sector just now who are experiencing this. Just now I've got friends who are in that industry themselves, and I know how just the care and the attention that they've taken to putting in measures in place to try and make their kind of facilities as secure as possible, and I know how difficult it is. So, but these decisions have been taken because of the evidence base that there is. We know that the hospitality sector is an environment where the setting is absolutely right for this virus to transmit. And what we need to do in order to try to drive down the numbers, to reduce the rate of growth that we have just now, is just prevent those opportunities for people to spread this virus from one to another. In the hospitality sector, the indoor nature of it, the close-knit proximity that people sometimes have within that environment, the disinhibition that sometimes goes with that, but also just there's so many different factors that all act together to kind of make that a higher risk environment. And the international evidence that is built around about this is absolute. Across the world, whether it be in Europe, North America or in Asia, what we are seeing constantly is case studies and reports which again point to the hospitality sector as an area where transmission is much more likely, just because people are much more likely to come together in that environment as well. And our own evidence within Scotland as well from the Test and Protect teams during the case interviews that we've had, again points to a strong association with people who've attended hospitality venues. So these decisions are not taken lightly at all, and I'm very grateful for people's forbearance with it, but this is something which is necessary at this moment in time to try to drive down these numbers and make sure that more severe restrictions are not required at some point in the future.
And what hospitality absolutely have a right to expect from government, if we are requiring them to close, is financial help, which is why the £40 million initiative that we announced last week is so important, to give help for people whose jobs are affected by this and to make sure they get paid, but also direct grant support for the businesses affected. So we have a part to play here in helping to mitigate the impact of decisions we are taking. Chris McCall from The Record.
Thank you, First Minister. We're now less than a month away from Remembrance Sunday, and there are suggestions the largest memorial services will have to be invite only due to social distancing requirements. Can you tell us whether ordinary Scots will be allowed to gather at their local war memorials to pay their respects next month?
We'll give guidance in good time and in due course once we've taken all of the appropriate advice. So we'll give that advice to the public, but also give that advice to organisations that would be involved in organising commemorative remembrance services. Remembrance Sunday is one of the most important days of the year. I know it's an occasion that is very important to me and it is important to people across the country. So it is absolutely vital that on that special day we all remember those who have given their lives in conflict and our armed forces who work so hard to keep us safe all of the time. How we do that, as with so many of the things that we usually take for granted in our lives, may be different, will almost certainly be different, but the fact of and the importance of that act of remembrance will still be there, and we'll give specific guidance about how we make sure that that is the case as soon as we can. Dan Sanderson from The Telegraph.
Thanks very much, First Minister. Under the traffic light system that's going to be introduced, it sounds like in England local councils will get a fairly significant degree of flexibility to set their own restrictions, perhaps over and above a nationally set baseline. Now, I know you've obviously consulted councils when you've brought in local restrictions so far, but obviously all the actual decisions have been made from the centre. So I just wondered if you were minded, when you announce your version of the system, to devolve actual decision-making powers to councils. I could also check with Dr. Smith. You were one of the medical experts who attended the SAGE meeting on the 21st of September, where a local circuit breaker, closing hairdressers, gyms, all cafes was put forward. Can I just check whether you stand by the recommendations put forward in that paper? And also, while clearly significant, are you concerned that the current restrictions in Scotland don't go far enough? Thank you.
I'll let Gregor answer that in a moment. I'll take the first part of your question first. In all of the local decisions we've taken so far, we have sought to engage with and consult with council. So going right back to Aberdeen, for example, although I know there's been differences of opinion between Scottish Government and Aberdeen City Council since then. Aberdeen City Council was fully involved in the decision to introduce the lockdown in Aberdeen. And we would listen and try to come to a joint decision about the nature of what we're seeking to do. And if councils thought we were going too far, we'd listen to that. But also if councils thought they wanted to do more. And yes, we will be having due regard to the right balance of decision making when these issues are faced in future through the tiered system that we put forward. We've also, forgive me, I don't know all of the detail of the legal framework in England, but I was reading, I think in the last couple of days, from one of the North of England councils, a request for councils in England to have more powers to close down individual premises. And my apologies if I picked that up wrong, but that is a power we gave to councils here. It's in one of the reviews, it's now a couple of months ago, of although it's for the government to say whether whole classes of premises are to be closed down, if a local authority has concerns over particular premises that they're not complying with the rules or there's a transmission risk, they have powers there to act. I think we want this to be as collaborative as possible. I think we should always avoid trying to... I think it's really important right now that people in positions like mine don't try to pass the buck for really difficult decisions. If there was ever a time for somebody like me to say, yeah, you take the decisions, it would be now, because these are horrible, difficult decisions that I don't wish on anybody. But I think when you're in a position like mine, you have a responsibility to carry the can and actually take the load of these decisions, but do that with as much consultation and engagement and discussion as possible. And yes, there are areas where it is right for councils to take decisions at a particularly local level. So we will continue to strive to get that right. I'm also very keen as we go into the next phase. This is likely to be a tough winter ahead, that Parliament has much more involvement at an earlier stage in these discussions, which is why the strategic framework that I've been talking about will go to Parliament after the break for debate and vote. So I'm all for trying to share the decision making as much as possible, but I think in a situation like this, the buck has to stop somewhere, and I'm afraid at the moment that's me and the Scottish Government. Sorry, Gregor.
So I mean, the SAGE structure has been a very valuable advisory structure for us to be a part of, and the discussion in it has been really incredibly useful over the last 7 months. I was part of the discussion on the 21st of September, where there was a wide range of opinions across the membership in relation to the kind of circuit breaker measures that you referred to, and what should make up the components of that. One of the things we need to remember in relation to that is that the purpose of SAGE is designed solely to give advice as it applies to the harm caused by COVID-19. But actually what needs to be considered in the round is the harms that come not only from COVID-19, but actually from the non-COVID health threats as a consequence of that, from the social impacts and from the economic impacts as well. And all that information needs collated together in the advice that goes to government while they make decisions. And that's the process that happens. So I feel confident that I was able to reflect the advice on the COVID-related harms, but also, please don't mistake this for anything else, I was also able to reflect the harms that come about from the measures that are put in place as well, because we can't ever shy away from that. One of the things that anyone with knowledge of public health will appreciate is that as you start to put some of these measures in place, they do have proportionate harms on other aspects of society as well, whether that be our social interactions with other people or whether that be the economic impacts that they have as well. And please make no mistake that those social harms and those economic harms are potentially harmful to our health as well. So all these things need factored in together as you begin to make a decision as to how you go about taking that advice and assimilating it into a package that actually balances the risk of harm across all those four elements.
Thanks, Gregor. Michael Blackley from the Mail.
Hi, good afternoon. One of the SAGE recommendations of 21st of September that you haven't yet followed is the recommendation that universities should be online only unless face-to-face learning is essential. Is there any potential in the coming weeks that you might revert or ask universities to revert to wholly online only learning? And also, just to pick up on some of your remarks from your opening speech today, you had talked about people preparing for self-isolation. Is there anything else that you think they need to be doing? I mean, should we, for example, be making sure that we have 2 weeks worth of essentials and food in our house if we need to self-isolate?
I don't want to, and I'm going to be very careful here because I don't want everybody rushing out to the shops and starting to panic by there is no need to do that. But, talk to people so that if you suddenly have to self-isolate, you've got somebody you can call on to get you essentials. And if you don't have anybody to call on, you've got the number for the National Assistance Helpline to do that. So I don't think everybody has to go out and start to panic in that way. Absolutely not. But think about who you would call on if you needed help. And for the rest of us, think about, is there anybody in our own lives that if they suddenly were advised to self-isolate would struggle with that, and what can we do now to give them a phone tonight and say, do you know, if you ever get the call from Test and Protect and you need to self-isolate, remember, give us a call if you need me to drop a bag of food at your front door or anything like that. It's just about thinking through these things. One of the, in a terrible, horrible global pandemic that we've all been living with the pain of for 7-8 months now, one of the heartwarming things has been the way we've all tried to look out for each other, and as we go into this next phase, that really is important again. And so what I'm saying to people is, think yourself, what would be the practical implications if you were having to self-isolate? Who would you call on if you needed food? And every one of us, just think through our own contacts. Maybe there's a neighbour across the road from you that doesn't have anybody close by. So maybe put a note through their door and say, if this ever happens to you, here's my number if you need me to drop anything off outside the door, obviously. Just wee things that mean we're all thinking about each other and thinking about how we help each other through this. Your first point was about universities. So in putting together the guidance for universities, we've tried to take account of clinical and expert advice to get the balance in the guidance between in-person learning and remote learning. And remember, there is limits on in-person, face-to-face learning in the guidance that, big groups of people shouldn't be coming together. There are limits very clearly on that. We keep all of that under review, depending on what is happening with the virus. And of course, a big focus of us, and will be an increasing focus, is the Christmas period for students and the potential for students to be going home and then coming back, and whether we need to change the guidance in any way to minimise the risks of that. So that's all under consideration at the moment. Do you want to say any more about self-isolation, Gillian?
Yes, thanks, First Minister. We know that self-isolation is absolutely critical as we're looking to contain the virus. But as I said in my opening remarks, we also know that it's exceptionally difficult for many people. And as the First Minister said, when we look back to the start of the pandemic, there was such a pulling together of communities to assist each other. It was really, really heartwarming right across the country. What we also need to do, however, as well as all of that community work, is to ensure at a government level, both national and local, that the support is there, so that people know if they're in that point of receiving that call from Test and Protect, that they don't have a concern about the financial impact, and they don't have a concern about whether they would be able to get supplies or not to them. So what we're determined to do is ensure that people have that level of support, that level of comfort, so that they know if they don't have a family member or a friend who will be able to help them, that they know assistance is out there, because we know that that support and that reassurance is critical when we're looking at encouraging people and ensuring that they self-isolate for the entire duration of the period that they've been asked to self-isolate.
And I'll just take the opportunity to give you the number again, 0800 111 4000. If you find yourself having to self-isolate and you've got nobody to call on, that is the National Assistance Helpline number that you can call, and practical support will be provided through that. Last question today is from Tim Magner from Carers World Radio.
Thank you very much indeed, First Minister. Unpaid carers in Scotland are telling us that they're really worried and to some extent confused about the situation over respite services. Of course, if you don't have them, that ramps up the mental pressure on the individual. And if you keep them open, it risks COVID-19 coming into the home. So what's the current situation, and what reassurance can you give our viewers about home support services to unpaid carers across Scotland?
Well, it's extremely important that people still have access to the support they need, whether that is support on a day-to-day basis or respite care. But as with all things just now, there is guidance and recommendations to make that as safe as possible. We'll make sure that there is updated, or the guidance that is there. We'll put I will get somebody to the Scottish Government Twitter account to tweet that with signposts to support and guidance that is available for people. And we will continue across all of these things to try to strike the right balances between giving people the normality they need in their lives, but also keeping people safe from COVID. And unpaid carers at all times, not just during COVID, do such an amazing service for all of us that they particularly need our support at this difficult time, and it's a responsibility we take very seriously. Thank you very much, everybody, for joining us today. My thanks to Anna for the BSL interpretation, to Gillian and Gregor and all the journalists. And again, thanks to all of you, not just for tuning in today, but also for everything you're doing to try to help us with the priority, the necessity of stopping the spread of the virus. We are, like so many other countries right now, at a really critical moment, and we've got to act together to stop it spreading. Just like we did back in the spring, by making sure we're following all the advice, following all of the hygiene advice that is out there, and acting to look after each other. And remember that this is all about protecting our NHS and saving lives. So thank you for everything you're doing. Remember to work from home if you can, stay out of other people's houses, respect the rules on hospitality, and remember facts. Wear your face covering, avoid places with lots of people, clean your hands and hard surfaces, keep 2 metres distance from people in other households, and remember to self-isolate and get tested if you have symptoms of COVID. It matters now more than it has done at any time since the spring of this year for us all to do this and reduce the opportunities this virus has to spread. So my thanks to all of you. I'll be back here tomorrow with I think the Chief Nursing Officer tomorrow, and we'll join you here again from 12:15. But for now, thanks very much.